Assalamu alaikum, dear doctors. So today we are going to talk about a clinical scenario. A 45 years old male patient came to you with shortness of breath, cough with purulent sputum production, and weakness fatigue. On examination, you have found expiratory and inspiratory, that is biphasic coarse crepitation that alters after coughing in both sides. So you must be thinking about a very interesting diagnosis, that is bronchiectasis, right? So this is a typical clinical scenario for bronchiectasis. In case of bronchiectasis, first we have to find the underlying cause of bronchiectasis. So what are the underlying cause of bronchiectasis? We can divide it into two types. Number one, congenital, and number two, acquired. So in case of congenital bronchiectasis, the common causes are number one, cystic fibrosis, number two, ciliary dysfunction, that is immotile cilia syndrome or primary ciliary dyskinesia, also known as PCD, and Carter-Jenas syndrome, which includes sinusitis. Second is bronchiectasis, and third is situs inversus. Okay, and another important congenital cause is alpha-1 antitrypsin deficiency should be considered, okay, if there is associated emphysema. Next, we will talk about some acquired cause. Acquired cause, first of all, childhood infections like whooping cough. This is a very severe infection which results in bronchiectasis. For child, foreign body is a very important cause, and infection with tuberculosis, that is also an important cause. NTM infection should also be considered. And we can also consider connective tissue disease. In rheumatoid arthritis, there is a very significant association of bronchiectasis. Also, we can find it in Sjogren's syndrome and systemic lupus erythematosus. So these are the causes in short. So after diagnosing bronchiectasis, you must find the underlying cause. We all know the investigation regarding this specific condition. So if we talk about the investigation, how should we proceed? First, confirmation of diagnosis of bronchiectasis. We must do a chest X-ray first. If there is visibility or cystic lesion involving both sides, then we must approach to HRCT. This is the gold standard. High resolution CT scan is the gold standard for diagnosis of bronchiectasis. So after doing that, we should approach with some baseline investigations like CBC, ESR, SGPT, serum creatinine, because this will help us to give the treatment. And next, we must approach with another very important thing, that is sputum for microbiology, because by detecting specific and infection, you can easily give or choose your antibiotics. Okay, so these are the first line investigation that you should do. Then you have to go for second line investigation. For second line investigation, you can do exclusion of the underlying cause by doing sweat chloride test. Sweat chloride test for cystic fibrosis. Then we can also do nitric oxide in nasal nitric oxide for PCD, and saccharin test can also be done for PCD. Then we can do immunoglobulin assay for CVID, that is combined variable immunodeficiency disease. Okay, we can do alpha-1 antitrypsin level for alpha-1 antitrypsin disease. So these are the important investigation we can do, and after getting any positive result from the following investigation, we can approach accordingly. Okay, we can do some genetic studies also. So this is all about the investigation. Then we will go to the management plan. So today I'm going to discuss stepwise management of bronchiectasis. There are 5 steps for management of bronchiectasis. Number 1, step 1, which includes treatment of the underlying cause. Number 2, airway clearance technique plus minus pulmonary rehabilitation. Number 3, annual influenza vaccination, and we can also give some antibiotic to prevent exacerbation. If after giving step 1 the patient is not responding and there are greater equal 3 exacerbation per year, then we have to move to step 2. In step 2, we just reassess the pulmonary rehabilitation technique and give some long-term antibiotic and mucoactive treatment. This is another important point. After giving step 2, if the patient is still not responding and greater equal 3 exacerbation per year, then first we have to give some inhaled antibiotics. If the patient is Pseudomonas colonizer, the choices of antibiotics are inhaled colistin, first line, inhaled gentamicin, second line, and then oral azithromycin should also be given. Okay. After giving step 3, if there is still no improvement, then we should approach the combination of inhaled and oral. That means we should approach with giving oral azithromycin for 3 months or 6 months. There we can extend up to 12 months, that is 1 year. Then we should also give associated inhaled colistin or gentamicin. Tobramycin is also a good consideration. After giving step 4, if the patient is still not responding, then we have to move to step 5. In step 5, we have to give the patient repeated IV antibiotic every 2 to 3 months alternative. Okay, so this is very important stepwise management for bronchiectasis. And another very important in case of bronchiectasis is chest physiotherapy. If we clear the mucus repeatedly, then we can easily help the patient get rid of exacerbation and repeated hemoptysis also. So I would like to end with a very interesting note. What are the CT scan or HRCT direct and indirect sign of bronchiectasis? So direct sign of bronchiectasis includes bronchoarterial ratio more than 1. That means internal bronchial lumen versus nearest pulmonary artery lumen. If the ratio is more than 1, this is very significant. Okay. Number 2 is lack of tapering. And number 3 is visibility of the bronchus near the costal pleura and near the diaphragmatic pleura. These are the direct signs. So what are the indirect signs? Indirect signs are bronchial wall thickening. Number 2 is mucus impaction. And number 3, and another very important thing is mosaic perfusion. That means presence of emphysema or air trapping in expiratory CT scan. So I would like to end today's video with this very good note. So bronchiectasis is very important disease, and after today's discussion, I think your concept is being cleared with bronchiectasis. Thank you all for watching today's video.